Hello people, in this video we are looking at this book Parsons Diseases of the Eye. This is by Ramanjit Sihota, Radhika Tandon, and this book is by this publisher. So let's look into this book. So guys, this book starts off with the anatomy and physiology of the eye, obviously, neurology also. Then you have the optics and refraction, similarly, myopia, hypermetropia, and what are the other optic errors, astigmatism, etc. Then ocular examination for how to examine the eye, right? How to examine the anterior segment, let's look at those. Then posterior segment. Then diseases of the eye, of the conjunctiva, of the cornea, of the sclera, of the uveal tract. Uveal tract means what, guys? The iris, the choroid, and the ciliary body, right? Those three together will be called uveal tract. Then you have the diseases of the lens, then glaucoma, diseases of the retina, where you will see diabetic retinopathy, hypertensive retinopathy of prematurity, retinal detachment, etc. Then vitreous, what and all will be there, vitreous hemorrhage, etc. Optic nerve, you will see optic atrophy, optic neuritis, etc. Intraocular tumors, you should be knowing retinoblastoma, etc. Injuries to the eye, chemical burns can cause pterygium, all those you may learn here. Again, that may also come under conjunctiva, right? Okay. Then that will cause a pseudopterygium actually. Disorders of motility, guys, all the strabismus or squint. In strabismus, you have so many types of strabismus, concomitant, incomitant, okay. This is of the adnexa, that is supporting structures. You can see lids, eyelids, what and all problems can you have? Chalazion, blepharitis, etc. Lacrimal apparatus, dacrocystitis. Orbit, diseases of orbit, what will you have? Orbital cellulitis, okay. Then systemic ophthalmology, guys, they're talking about systemic ophthalmology means diabetic should come here, right? How diabetes will affect the eye, or how another systemic disorder can affect your eye, right? Then preventive ophthalmology, all your community medicine, national program for control of blindness and visual impairment, all those. Okay, and they're talking about that. Then surgical instruments, what and all instruments you will use, all the lid retractors, etc. Anesthesia, they're talking about lasers, etc. IOL designs, materials. Let's look at all this. So anatomy, physiology, what is this? Pupillary reflex. They didn't label this diagram, is it? Look at this. This diagram doesn't come with a number or anything. Oh, okay. It's here, sorry. Figure 4.7. Sympathetic pupillary system. This is the sympathetic pupillary system. Guys, in this they have the central, which is hypothalamic. Then they have second, they have marked preganglionic, and then the postganglionic they have marked here. Something looks like. What is this? Mirror retinoscope. Mirror retinoscope. Guys, what do you think C is? C and P. C is concave mirror and P is plane mirror. So it's a retinoscope. Retinoscopy being performed. Look at this. So many images here. What is this? Disc principle. It's used in automated refractometers. AR. They will write AR, right? That is this automatic refractometers, guys. What are we doing? We are looking at this book, Parsons Diseases of the Eye, and we are currently looking at this. This is a set of cross cylinders. This is a set of cross cylinders. Have you seen this? Okay, what is this? What are they doing here? Photographs showing the clinical use of the cross cylinders. And here they are showing you the keratometer, guys. How they will check the curvature of the cornea, right? And then they will have to see, they'll have to make this minus has gone up. See this? And here this plus has gone here. They've kind of synced them. So this is the Bausch and Lomb keratometer. Bausch and Lomb keratometry Myers. The upper figure shows non-aligned and the lower figure shows the endpoint for alignment. Just turning a few pages here of this book. This one is that breaking up of the halos, right? Stenopake's test for colored halos. Yes. So are they explaining why these colored halos will split in cataract? We'll have to read and understand. If they have explained why these split up and all, that will be really great. They seem to be explaining, guys. If you have time, then just read this, okay? C. When C is reached, only vertical fibers are involved, okay? Vertical. And the portions appear to reunite, correct? Okay. This is the Humphreys automated perimeter. Look at this. What is this? Test for binocular vision and measuring stereo acuity. What is this? A Bagolini striated glass. Striation I can see. Okay. Bagolini. What is this? Stereo flight test. Virit. Oh God, these are like very hi-fi. What is this one? E. What is this guy doing? E is E and FR Randot stereo acuity test. Too much. Guys, this is at the end of every chapter. What is there we have to check, right? Because some books will give some nice interesting questions and all that. Here there is a summary of the chapter and suggested reading. Leave suggested reading. Summary. Examination of a person's, which chapter is this? This is assessment of visual function. So assessment of visual function in this book, guys, focus Parsons Diseases of Eye. Look at this summary. Examination of a person's vision includes testing various visual functions like visual acuity, field, dark adaptation, contrast sensitivity, color perception. Contrast sensitivity, how do you check? Electrophysiological tests like electroretinography, electrooculography, VEP are objective measures. Okay, tests for binocular vision, stereo acuity. Okay. So many things it seems they have covered in that chapter. So what is this? Examination of posterior segment. How much have we finished? Not even half. Let's go through some things here. What is this? Corneal ulcer, which is marginal. Yes, we can see that due to staphylococcal hypersensitivity. Okay. Then so many images here, guys. Let's turn some pages. Ophthalmos in 8-month-old child. The left eye is larger than the right. Yeah, it is. Okay. This ophthalmos means bullseye, right? But only one is, in this case, only one actually. Okay. This is what visual field. All this you would have seen in first year of MBBS itself, right? So many images here. What is this? Traumatic cataract. Should be rosette, right? Does it look like a rose to you? Rosette to you? Showing a posterior rosette and zonular dialysis. Personally, I don't see a rosette here. Section 5, motility disorders. So here they will talk to you about all the squints, right? They're first explaining how the eyeball moves, all the muscles, their function. Let us look at this one. This looks interesting. What is this? Field of binocular single vision. Single vision, okay. So what does this actually tell you? Superior, you should be able to see least actually because of your eyebrow supraorbital ridge, is it? What are they doing here, guys? They're checking for phoria, right? Next. So many things here. What is this? Histology image they have given. What do you think these are? These pleomorphic lacrimal gland adenoma, histology of the glandular tissue and squamous differentiation with keratin formation. So they are talking about lacrimal gland adenoma. Wow. Okay. And what are these? Squamous differentiation with keratin formation. Look at the CT image. Coronal CT shows an oval mass. Looks like there is some mass here, right? This one seems fine. What do you say? But lacrimal gland adenoma. So gland is where? Gland is here, right? Gland is here. Sac is here. Okay, guys. Turning a few more pages. This one we can tell, no, what this is. But it is unilateral. So what is this? Lacrimal mucocele. Okay. Just 2 seconds, you will say what this is. Proptosis and thyroid eye disease. This is what? Graves. Graves ophthalmopathy. Okay. Is it becoming too much, guys? We have almost covered more than 3/4 of this book, Parsons Diseases of Eye. Let us look at some more photos here which may help us learn some things while we are looking at the book. Nasopharyngeal carcinoma extending into the right orbit. So this is marked as right. So nasopharyngeal carcinoma extending into the right orbit. Okay, and here our right orbit. Okay. Tell me one thing, why would they put this CT picture which is flipped? What would the reason be that they have flipped it and published this? Okay, look at this orbital lymphoma. Orbital lymphoma. Diseases of the nervous system with ocular manifestations. What will you see here? Guess. Diseases because of meningitis, what can happen to the eye, etc., right? Demyelinating disorders. Name some demyelinating disorders, guys. Multiple sclerosis, neuromyelitis optica, Marburg variant, acute disseminated encephalomyelitis. Okay, too much. Prion diseases. Okay, how all these things will affect the eye. Do you want to look at this one? Dilated episcleral vessels in a patient with carotid cavernous fistula. Carotid cavernous fistula. Okay, and now it has affected the eye. Okay, guys, look at all this in detail based on what is there for your exam. You can read. Otherwise, I think it may be a little too much. What do you say? Vision 2020, the right to sight, community medicine here. Guys, this one looks a little interesting. Okay, just pay attention here. Surgical instruments in ophthalmology. They have covered a lot. What are these? Wire speculum, Barracker wire speculum, Jaff's wire lid retractors may be clamped. Okay, so many things. Actually, not all instruments may be kept for you. Just check with your college what instruments you need to know. Okay, what is this? Various type of forceps tips. The tips of forceps, how they can be different, right? Fixation forceps, Colli-Breeze forceps. I think this is important for suturing. Guys, look at this one. McPherson forceps. I think this is also important. Non-toothed. Why are they using this? To hold the lens capsule. Handling the intraocular lens during implantation. Okay, McPherson forceps. I think we should make a video on just these. You know, the way they have kept it. Look at this. All the instruments looks like they are there here. And they have put numbers here and you can know what they are. And some of these look so similar. Look at this. 24, 25, 26 look so similar. Let's see what they are. Wait. Where is 24, 25, 26? Here, guys. 24. Castrovejos corneoscleral scissors. Castrovejos corneoscleral. Both are same. And 26 is micro iris scissors. Which is Vannas or no? Something else. Okay. Where is Vannas? 29 is Vannas capsulotomy scissors. Where is 29 here? Here. So this is a scissor, this is a scissor, and all these are scissors looks like. Westcott's is 28. Westcott's is important, guys. Westcott's scissors. Guys, remember the scissors, no, they will have X kind of formation here. Can you see this? X kind of formation, that will be a scissor. But these are all no, they are not having X. So they are just having straight, like they are a holder. Like 32 will be a holder, let's see. 32 will be what? Yeah, Baracker's needle holder. You understood, right? So how you differentiate a scissors and a holder? They look very similar if from far. You have to go nearby and check. Way too much information for you. Okay guys, so many instruments. We can talk about this itself for a whole century. But what exactly is this? Why have they put another image with, these are for phacoemulsification set. Oh, they are giving the set. Okay. This is nice, guys. Know this one also. What is the 7? This should be easy. Calipers, right? What calipers is it? 7 is Castrovejos caliper. Can you tell me what this is, guys? This one? 5. Irrigating contact lens. Okay. This is that evisceration scoop. I think there should be a hole in the middle, right? Looks like if there's a hole in the middle, it is the Wells enucleation scoop. This one is evisceration scoop. Okay. Guys, so we have almost come to the end of this Parsons Diseases of Eye. We have looked at it much in detail, so that we understand things. See, this one is what? Retrobulbar, right? Am I saying correctly? Blue is retrobulbar, yes. And this one is peribulbar. This one is peribulbar. FR is what? Frontal. Okay. See, retro is behind, so you can easily say this is retro and this is peribulbar. P1 is peribulbar. What is it? It is anesthesia, where you give the anesthesia. Okay. So you have different types of anesthesia: peribulbar, retrobulbar, parabulbar, subtenon block. Subtenon is also called as parabulbar. Okay. Intracameral anesthesia, facial block, frontal block, all these different types you can say for your viva if they ask. Here in this page they have given you the IOL designs and materials, guys. So this one is the intraocular lens. So you have haptic designs, different types of shape, size, optic. This is the optic. Different optic designs, different haptic designs, materials that they can use: PMMA, silicone, acrylic, then UV absorbing, blue light filtering, etc. Just remember PMMA and silicone. I think that should be enough. Haptic materials, what will they be? PMMA, silicone again is there here. So go with those only. Important points to remember in each chapter. Okay guys, I think we have spent way too much time with this book. So let's close this video on this book, Parsons Diseases of the Eye. I think I liked the instrument part of it, but otherwise just go for Khurana for undergraduate level. What do you say, guys? That's all in this video on Parsons Diseases of the Eye. Bye bye.